All right, so listen to this. Ready? A health insurance CEO was shot.
Oh, wow.
But this isn't some kind of true crime story. We're going deeper
Right.
into the why, what it says about healthcare in America,
Yeah.
and maybe even what we can do about it.
This case has really gotten people's attention,
Yeah,
and it's making us look at some tough stuff about our healthcare system and the
right.
frustrations people are feeling.
Exactly. So picture this. 26-year-old Luigi Mangione. He's the alleged shooter.
Okay.
Doesn't exactly fit the profile you'd expect.
Good.
From a wealthy family, deep ties to the healthcare industry.
Hmm.
I mean, his grandfather owned hospitals and nursing homes.
And to make it even more ironic, the family's known for giving to healthcare charities.
Right. Total movie plot twist.
Yeah.
But then we get Mangione's alleged manifesto, and
Ew.
it paints a whole different picture.
Yeah.
He criticizes the U.S. healthcare system, calls out high costs, poor outcomes, the power of corporations. Sound familiar?
Definitely. We hear those criticisms all the time.
Yeah.
And the data backs them up. Mangione's anger, even though it was expressed in a terrible way,
Yeah.
might resonate with a lot of folks struggling with bills, insurance,
Yeah.
feeling like profits matter more than patients.
Okay, let's unpack those criticisms. Starting with the cost of healthcare in America. Mangione's manifesto says it's the most expensive in the world. Is he right?
He's not wrong. The U.S. healthcare system, it's projected to hit a whopping $7.7 trillion in spending by 2032.
Wow.
That's over $21,000 per person.
Wow.
Almost 20% of our whole economy.
20% of GDP.
Yeah,
That's a huge piece of the pie. Really shows you just how much we're spending on healthcare.
it does.
But where is all that money going?
That is the million-dollar question. A big chunk, something like 30%, is eaten up by administrative costs, paperwork, insurance claims,
Right.
billing disputes, all that jazz.
Yes.
Stuff that's not directly about caring for patients.
Yeah.
And then there's labor, makes up about 55% of hospital costs. Not surprising given the staffing shortages we've been seeing.
That makes sense. Administrative costs, labor, but that's going to be less than 90% right.
Right.
Where's the rest going?
Well, can't forget about prescription drugs.
Oh.
They're a major factor. Account for about 10% of the extra spending compared to other developed countries. And of course, all this ends up hitting patients' wallets as out-of-pocket costs.
Deductibles, co-pays, surprise bills.
Exactly. The stuff that can really hurt people financially.
Makes you think, is a system where people have to choose between their health and their bank account really working?
Yeah,
I mean, even having insurance doesn't guarantee peace of mind anymore.
you're right. Actually, half of insured adults say they struggle to afford medical or dental care, even with coverage.
Wow.
And this isn't a short-term blip.
Oh, right.
Healthcare price growth has been outpacing inflation for years.
Yeah.
Persistent problem. It's only getting worse.
Okay, so we know U.S. healthcare is incredibly expensive. Manjone's next point is, despite all this spending, we're not getting good results. His manifesto says the U.S. lags behind other countries in health outcomes.
True, even though we're shelling out so much.
Sadly, yes. The U.S. falls short on key health things, like life expectancy
Right.
and infant mortality, even though we spend twice as much per person as similar countries.
So we're spending more but not getting better results.
Right.
Does spending more always equal better health? We reached record high insurance coverage, 93.1% in 2023.
Yeah.
But it sounds like that's not the whole story.
It's more complicated than just looking at spending.
Right.
While insurance is vital, millions of Americans are still uninsured.
Right.
They face huge hurdles getting the care they need.
Yeah.
Even for those with insurance, other things matter too, like social factors,
Yeah.
disparities in access, and the quality of care overall.
Okay, let's move on to Mangione's last big criticism, corporate influence in healthcare. He seems sure profits come before patients. What do you think? This is where things get tricky.
Okay.
Any industry needs profit to work. But in healthcare, where people's lives are on the line, there's a big potential for conflict of interest.
Right.
When money drives decisions, there's a real risk patient care could suffer.
I see. In a profit-driven system, what happens to the quality of care? Are treatments getting pricier? Is access to essential services being limited?
All valid concerns. It's a tough ethical question we got to face as a society.
Yeah.
But here's where it gets even more interesting. The public's reaction to this case has been, well, unusual.
Unusual is putting it mildly. There's a lot of online support. for Mangione.
Hmm.
The hashtag Free Luigi is trending.
Oh, wow.
And then there's this whole thing with, get this, health insurance murder ballads on TikTok.
Really?
Yeah, dark humor for sure, but it shows how angry and frustrated people are with the system.
It's fascinating, isn't it? What does it say about us that a violent act, however misguided, triggers this kind of response?
Yeah.
Are we so fed up that gallows humor and even, in some cases, support for violence become our coping mechanisms?
This case has definitely hit a nerve. It's making us confront some uncomfortable truths.
Yeah.
It's a stark reminder the way things are isn't working. Violence is never okay.
Of course.
But Mangione's actions, tragic as they are,
Right.
have ignited a crucial conversation about healthcare in America.
Absolutely. It's pushed issues like access to care, insurance practices, and corporate accountability into the spotlight.
Right.
And while there are no easy answers, this dialogue is vital if we want to build a healthcare system that actually serves everyone.
So let's dig deeper into those potential solutions. If you had a magic wand, could change one thing about the U.S. healthcare system, what would it be?
That's a great question, and it's one we'll explore as we continue our deep dive into this complex issue. Stay tuned. If I had that magic wand, I'd start by tackling those root causes we talked about. Remember those administrative costs? Mangione was right to be annoyed about those.
Yeah, 30% wasted on paperwork and bureaucracy.
Huh?
It's crazy how much that could be used for actually helping people get care.
Exactly. Streamlining those processes, simplifying billing, maybe even bigger changes like setting standard rates for everyone could free up billions of dollars.
Okay, that makes sense for cutting costs. But what about the corporations? Mangione was pretty insistent that they put profits ahead of patients. How do we fix that?
That's the tough one. One way is more transparency.
Okay.
Let people see prices and profit margins so they can make informed choices.
Right.
We also need stronger rules to stop price gouging, especially for essential meds.
Speaking of drug prices, that's been a problem forever. Doesn't seem like anything changes.
Yeah.
Could giving Medicare more bargaining power finally bring those costs down?
That's one idea being tossed around, and it's worked in other countries. No reason the U.S. couldn't try it, too.
Makes sense. What about all the people who are still uninsured? How do we make sure everyone can get affordable, quality health care, no matter their income or job? Mangione also talked about those poor health outcomes. It's not just the cost.
Expanding coverage through programs like Medicaid, or maybe a public option that competes with private insurance, those could really boost access. In the end, we got to shift our thinking.
Okay.
See healthcare as a right, not a privilege.
That sounds great, but realistically, healthcare reform is a mess. Getting anything done in this political climate seems impossible.
It's true, it's complicated. Lots of different people involved, lots of opinions. But this case, as tragic as it is, has brought a new urgency to the conversation. People want change. That could be powerful.
We have seen people demanding change lead to results before. Maybe this time is different. But what do you think is the single most important thing we could change to make U.S. healthcare better?
Honestly, I'd focus on preventing problems before they start. Early intervention, too. It's way cheaper to keep people healthy than to treat them once they're already sick.
Interesting. We're so focused on treating diseases, we forget about preventing them.
Exactly. Investing in public health, promoting healthy lifestyles, making preventative care easier to get, those would be huge steps forward. Better outcomes, lower costs in the long run. It's about being proactive instead of reactive. And it helps everyone, not just people who are already struggling with their health.
Yes. So instead of always trying to fix problems, we need to stop them from happening in the first place.
I like that. What do you think our listeners would say? If they could wave a magic wand, change one thing about U.S. healthcare, what would it be?
That's a great question for our listeners. We want to hear from you. Head to our website or share your thoughts on social media. Use the hashtag #HealthcareDeepDive. Tell us what you would change.
Let's keep this conversation going. It's important to hold our leaders accountable. We need solutions that prioritize the health and well-being of all Americans, just like Mangione's manifesto argued for. Absolutely. We can't let this tragedy be for nothing. We got to turn our frustration into action, work towards a future where quality, affordable healthcare is real for everyone. Like all those people online calling for change.
You know, it's easy to get overwhelmed by all this.
Yeah.
Rising costs, bad outcomes, corporate influence. Politicians can't seem to agree on anything. Where do we even start?
It's true. There's no quick fix. But I think one of the most important things we can do as individuals is to get informed and get involved.
What do you mean by that?
We need to really understand these issues.
Okay.
It's not enough to just skim the headlines. We have to dig deeper into healthcare policy, like we're doing here, but taking it even further.
So doing our own deep dives, basically.
Exactly. There's a ton of information out there.
Yeah.
Reliable news sources, think tanks, advocacy groups. Take the time to learn about different viewpoints and solutions.
Okay, so let's say we've done our research, we're informed. What then? What can we actually do to make a difference?
That's where getting involved comes in. Contact your representatives. Make sure they know healthcare reform is important to you.
Right.
Vote for candidates who support policies that align with your values.
A lot of people feel like their voice doesn't matter, especially with something as big and complicated as healthcare.
I get that, but it's just not true. Politicians listen when their constituents speak up. The more people who demand change, the more likely we are to see real progress.
So it's not just about voting every few years, it's about staying involved, making our voices heard all the time.
Exactly. And it's more than just contacting politicians. Support organizations working to improve healthcare. Volunteer, donate to causes you believe in. Even just talk to your friends and family about it. It all helps raise awareness.
It's about building a movement, pushing for a better system together.
Right. The challenges are big, but I really believe that if we work together, we can build a healthcare system that's fairer, more equal, and truly meets the needs of all Americans.
Well said. And on that note of hope and collective action, I think it's time to wrap up this deep dive. Heavy topic, but I hope you've learned something about how complex the U.S. healthcare system is and some of the possible solutions out there. It's not about agreeing with what Luigi Mangione did, but about understanding the problems he brought to light.
This case, as awful as it is, shows us that the current system just isn't working. We have to demand better, and we have to work together to build a future where good healthcare is a right, not a privilege. Just like all those people online are saying.
Absolutely. And remember, the conversation doesn't end here. Keep learning, stay engaged, and keep fighting for a better healthcare system for everyone. Thanks for joining us on this deep dive.